We have an exciting program in store for you today, a panel that promises to have, I think, a robust conversation about the issues. I want to thank our panelists for being here, and I especially want to thank our mayor, Kathy Sheehan, for taking the time to be with us today. Some of you have traveled quite a distance to be here, and all of us look forward to learning from your experience and you sharing that and your expertise with us. I'd now like to welcome Dorcey, who will be our moderator for the day. She is the Faculty Program Director for Public Health in our School of Health Sciences. Our School of Health Sciences is the sponsor of today's event. Dorcey?
Good afternoon. So as mentioned, my name is Dorcey Applyrs, and I will be moderating today's panel. Before I begin with calling up the panelists and starting with questions to our panelists, I would first like to throw out some questions to you, our audience. So by show of hands, how many of you work in the field of public health or a health-related field? Okay. What about work in the business sector? Great. And lastly, how many of you work on community projects or urban planning projects? Great. Thank you so much. This was just to give us, myself and the panelists, a good feel for who is in the room today. So as was mentioned, the purpose of today's panel discussion is to explore the reciprocal relationship between health and economic development. By doing so, we aim to shift mindsets about what's possible by discussing ideas and strategies that lead to healthier and strong communities. In the city of Albany, like other urban settings, we are seeing neighborhoods change because of new economic investments from businesses and healthcare institutions. These investments are coming at a time where middle-class Americans are fleeing the suburbs for urban living. Young professionals and seniors find walkable communities and easy access more appealing. And communities of color and low-income families in our urban communities are fighting for equitable access and affordable housing. An important question is, as our neighborhoods change due to economic investment and development, are we being intentional about shifting our thinking and seizing the opportunity to work across sectors to create healthier communities? Joining us today to answer that question and other questions, we have an esteemed panelist, and I'm going to ask that they join me at this time. And you can applaud them as they walk up.
We were assigned seats. We're not doing a dance up here.
Okay. Bear with me. Thank you. Okay, so let me introduce who we have with us today. So right next to me, I have Mayor Kathy Sheehan from the city of Albany, and we actually work closely together. My other hat in the community, I am a city councilwoman, and I represent the First Ward in the city of Albany. So Mayor Sheehan and I work together quite a bit. We also have Kaitlyn Meirs, who is a program associate with the Robert Wood Johnson Foundation. Next to her, we have Dr. Karen Lee, Health and Built Environment Consultant. And then last but not least, we have Trey Hairston, who is an attorney with Butler and Snow, based out of their Mississippi office. So we'll jump right into the questions. And the first question I'll throw out to Kaitlyn and Dr. Lee. And the purpose of the first question is really to provide some context and to conceptualize the conversation. How would you define the term built environment, and how does the built environment impact community health?
I think Kaitlyn and I had a discussion right before this, and we said I'd go first, so I'm going to go first. So the built environment really refers to our human-built environment. So things like our buildings, our streets, our neighborhoods, the amenities that we put into them. Are there good transportation options and infrastructures? Are there recreation spaces? What do we do with our offices and our workplace buildings and workplace sites? What do we do with our school buildings and what goes in them and around them? So those are examples of our built environment.
Great. So I'll build on that a little bit and tell you a little bit about the Robert Wood Johnson Foundation sort of as a whole. So we are the largest foundation in the country exclusively funding health, and our new mission is to build a culture of health. And what's really exciting about this new vision is that everybody can interpret that a little bit differently. But one of the most important pieces of building a culture of health is having a really healthy environment for everyone to live in. So nearly 1/5 of Americans live in neighborhoods that make it hard to be healthy. We need to change that, and it requires work across sectors. So planning, education, economic development, community development, all working together. And that's how we create a culture of health and impact the built environment in the same way.
Can I just add that it's not only in current day that we have to think about our human-made environments and how they impact health. In fact, if we look at our history as many cities and as many communities, that's actually how we dealt with the public health epidemics of the past, right? So when we had waterborne diseases as leading killers, when we had mosquito-borne diseases, and some of them are reemerging now as major killers. One of the things that we did in the past, in the era before antibiotics, was we actually created sanitation infrastructures, clean water, sewage treatment plants. We actually built our buildings so that they would have ventilation. We actually addressed things like puddles that would breed mosquitoes in our communities. And that's how we addressed the major epidemics of the 19th and early 20th centuries. Today, we've got epidemics of obesity, diabetes, heart disease and strokes and cancers are our leading causes of death. Mental health issues are a major source of healthcare costs and of morbidity. And injuries as well are a leading cause of deaths, particularly in younger people. And all of these major health burdens that we are faced with in all of our communities today, including increasingly in the developing world, we can address by building a healthier environment.
So I want to just build on that. We're going to be going back for that. So sometimes policies and practices have unintended consequences. And many consequences that we hear about today are negative ones. We always hear about how, this happened and this resulted. But sometimes we can have positive unintended consequences. So who here has heard of Easy Pass? Yeah, we all have, because we're in the East Coast. In California, we don't always have that in an audience. Easy Pass reduced the occurrence of low birth weight births within 2 kilometers of the stations in which they were put. Low birth weight births never moves. It never moves. A lot of you are health professionals. You can't affect it. You affect it for a little while and then it goes back. But there was a policy put in place, Easy Pass. We changed the environment. We made it easier for cars to go through an area, and the surrounding communities benefited. So we didn't know that that was going to be the case. but we can think about the policies and practices that we're putting in place beforehand so that we're not just thinking about the unintentional negative consequences, but those unintentional positive consequences as well.
Thank you, Bo. So the next question I'll open up to the entire panel. How does the emphasis on community revitalization present opportunities for public health?
Mayor?
I'll start
Take a stab
with
at
you,
it.
Trey.
From the standpoint of growing healthy communities, I think a large component of that can really be pushed towards workforce development. In Mississippi, which I'll focus on, we have the largest indices of obesity and diabetes, and a lot of our resources are sometimes pushed towards job creation components, and so as a result, one of our focuses that we decided to narrow down on was how do we bridge healthcare and economic development, and instead of focusing on recruiting large manufacturers like Toyota or Nissan, which are great, how can we bridge those two things and hone our economic development incentives around healthcare? And so we did. We created legislation that focused on lining those incentives and tooling them to focus on the healthcare industry. And we took some of our affordable housing tax credits and we forward committed those to focus on producing workforce development housing in areas around healthcare zones. And so we created these 5-mile radius zones around large hospitals throughout the state. And it's worked to produce a tremendous amount of investment, job creation. Over 2,000 jobs have been created, and over 600 homes and units of housing have been built since 2012 using this program. So I think by channeling certain resources that may already exist towards developing identity around healthcare, which is a growing and emerging industry, I think we can certainly promote healthcare and both bridge those two topics.
Thank you.
Well, one of the things is we look at the city of Albany, for example, and being able to look at the strength of our built environment. We have an historic city, we have great bones, and we are looking at ensuring that as people are seeking to locate themselves in that livable, walkable, bikeable environment, that one of the areas that people worry a lot about when they come to a city is public safety. And so public safety is a really important component of all of this, particularly since it's in some of our neighborhoods that have been neglected and have been disinvested from are places where we have the highest rates of safety issues, of crime, of young people in particular being at risk for their health because of the environment that they're in. And so, for decades, we used the criminal justice system in order to address what were really societal issues, right? President Obama said we do a lousy job of educating young people when they live in concentrations of poverty. We do a lousy job connecting their parents to jobs. We do a terrible job of connecting people, particularly with mental health issues, to the medical care that they need. And so what we've done is we've done it on the cheap, right? We arrest people. We use the criminal justice system to address that issue, which then feeds the disconnectedness of the neighborhoods. It feeds into the sense that the police are an occupying force as opposed to being part of our neighborhoods. And so as we in Albany have looked at this, we've taken a step back, and we're now only the third city in the country to implement law enforcement assisted diversion, which is very much linked to the healthcare industry, because it's about, even before somebody gets arrested, connecting them with the services that they need to either deal with their addiction issue, their mental health issue, issues of poverty, issues of homelessness, as opposed to arresting them and using the more expensive and more punitive criminal justice system to address that issue. And so when we look at, it's not an unintended consequence, one of the intended consequences that we'll be looking at as we roll that out is, are we having a positive impact on health because of that approach?
Thank you.
I was going to say that, I think how we revitalize our communities is actually really important. And there are tremendous opportunities to find synergies for multiple of our priorities, right? So there's clearly economic priorities, but there's often health priorities. There are often also environmental priorities. And we can actually, if you have an aging population and you want people to be able to age in place as they stop driving and stop being able to drive, those things actually have common parameters, right? So I think the mayor talked about walkability and, communities that actually support multiple options for moving yourself, right, are actually really important communities for access to services, regardless of who you are. If you're a child, if you're a parent with a stroller, if you are, aging and you can't drive anymore, if you're in a wheelchair or have to use a walker or a cane, right? Those very walkable communities where you can cross the street safely, where you can access amenities close to where you live, are actually really important pieces of that. So there's active transportation, there's active recreation. So having opportunities for active play, really important also for improving health and for boosting things like real estate values, right? Walkable communities, bikeable communities. When I was working for City of New York under Mayor Bloomberg's administration, our city actually actively did studies of the places that we revitalized with things like pedestrian plazas, bicycle lanes, where we improved bus rapid transit. And we actually found that when you made these interventions, economic outcomes actually improved also. So retail sales, for example, in Times Square, lots of concern that pedestrianizing it was gonna basically cause businesses to go under. And of course, by collecting the data, we were able, before and after, we were able to show that businesses soared. And economic and retail outcomes, actually, in Times Square now, are amongst the top 10 retail areas in the world. And that never happened before pedestrianization. Healthy food access is another important one, right? So when I was with City of New York, one of the programs under me was called Fresh Food Retail Expansion to Support Health. My team worked closely with economic development and with city planning, and we created a set of zoning and tax incentives to create and expand supermarkets in our food desert neighborhoods, usually our poorest neighborhoods. And that also created jobs as well as access to fresh, healthy produce. So, and then, thinking about our buildings as well, active buildings, right? How often do we see modern buildings that, just inadvertently put in an escalator when all you have to do is go 1 or 2 floors, right? And escalators don't help people who have disabilities to actually properly use them. So we need access for elevators for people who have access issues, disability issues. But everybody else, if they're going a few floors, we should be encouraging them to walk the stairs, right? That saves energy, right? As opposed to escalators and elevators. It actually makes elevators more accessible for people who need them because they're less overcrowded and they don't stop at every single floor. And so there are actually these multiple benefits if we think proactively and consciously and conscientiously about how we create our environments. So I think earlier you talked about unintended consequences. But I think what the research is showing us today is that there are actually a whole host of strategies that are evidence-based, that have been tried and evaluated in other communities that we can consciously adopt to actually get multiple benefits at once. Just one document I want to raise your attention to that I was asked to work on and help on is this document called Designed to Move Active Cities, a Guide for City Leaders. You can find it on the Global Resources page on my website. I think there's a handout with my website on it. And it actually gives you all of the different co-benefits that can come from creating healthier communities.
So when we think about community revitalization and revitalizing an entire neighborhood, many times we're talking about low-income communities. And those are communities with historical disinvestment. And when a lot of money gets funneled into that community, property values tend to go up. And because property values tend to go up, the community that was living there before generally has to move. They cannot afford to live there anymore. And so we call this gentrification with displacement. And it is a serious consequence of community revitalization. And I will say, all of you are here because you're interested in this topic. You are not alone. There are people all over the country trying to figure out how to do community revitalization, health, and do it well. Do it with good intentions. And so I just want to bring your attention to a few projects that are happening. So recently we announced our Invest Health cities. There are 50 mid-sized cities that are coming together to work on this idea of how do we get money into low-income communities, but do it in an equitable fashion that doesn't move people out of the place that they're living, right? So how do we put policies in place to protect that community, their culture, their social cohesion, because this is ultimately about the people that live there, not someone coming in and moving them out. So in New York, there are 3 cities that are involved in this project, and I think the cities are actually starting to meet tomorrow. So it's Syracuse, Rochester, and Buffalo are all a part of this. Reach out to those teams. They're there learning, and then all of that curriculum is going online. And so they can become a resource for New York, for Albany, for everyone across the country to do this because we're all working through it together. There are certainly strategies out there, but we do not have the here, do this, and your community is going to be healthier.
I'll say this, in the city of Memphis, there was a project that we worked on, and it's a 1 million square foot warehouse. It used to be the old Sears Roebuck distribution center. But essentially what happened is we put together 17 revenue streams from equity to government finance, and essentially we built, or we're currently building, a community under one roof. A charter school, market rate housing, affordable housing, healthcare, fitness, all under one roof, retail. And so from the standpoint of going back to leveraging assets that are already in place and shaping policies to focus on, if this is our identity as a community, if we're going to be a healthy community that's going to focus on targeting the healthcare industry, then I think you can shape and tool your incentives or your resources, whether they be CDBG, new market tax credits, historic tax credits for an old property like that, and channel them all towards one purpose. And I think that may be a solution towards getting around the idea of gentrification.
Great. So you all have moved me forward because you started talking about strategies. So I want to go with the flow and build off of what you all have started to talk about. So in addition to what has already been mentioned, what unique approaches have you implemented or are aware of that have bridged health and economic development in the context of revitalization?
So, building on the concerns about gentrification, every city is different. So the city of Albany has seen tremendous investment in market rate housing, but that has occurred in our central core of downtown, which was not a residential neighborhood. It is the result of the conversion of office space to market rate housing. So we haven't seen the displacement because there was nobody there to displace. The challenge that we have in the city of Albany is that we have such high concentrations of poverty because of policies of the past that concentrated poverties in very, literally a few square blocks. And so we have people in our community, when they see new affordable housing being built, so our housing authority is trying to de-densify its towers. So it built new Albany Housing Authority housing in the South End, and there were those who said that's gentrification because it's nicer public housing, right? And so, that's not gentrification, and that's not something we should be patting ourselves on the back for. That's creating a built environment that is safer and healthier for the people who already live there. But if we really want to take that next step and start to have the mixed income multi-use type of project that you have, we need to be looking at our policies, and we need to be advocating with HUD and with the state to be more creative about the incentives that they are putting in place in order to make that happen. So when it comes to looking at healthcare, for example, We have a College of Pharmacy here that is interested in creating a pharmacy that its students could use as part of its education process that would be able to provide affordable medications. Well, the number of hoops that we have to, right? It sounded so easy. I had breakfast with the president. I'm like, go, do that. Yeah, go. Check. The negotiations with the insurance companies, all of the things that have to happen. But one of the things that I did was I was approached by some people from the South End who wanted to build a community center that was health-based. And so I said, okay, let's put the two of you together, because there's some money over here for this part of the project. There's a desire to bring in these partners, so let's bring that together, find space, and do this in a cohesive way as opposed to in our silos. And so, in looking at what is innovative and what is creative, some of it is just little sort of low-hanging fruit, right? Because gentrification isn't necessarily when you're lifting the standard of living in a neighborhood. And as a mayor, that's what I'm interested in doing, right? I'm interested in looking at a neighborhood and saying, how do we lift people out of poverty and provide them access to jobs and access to opportunity? And so it's those direct links of saying, there's a new hotel in downtown Albany, we want you to interview our people first, right? And again, that's more relationship-based. It's not a policy, it's will. It's having the will to get people in the room and look them in the eye and make those requests. And that's how we're building it, and some of the things that we're doing in the city of Albany. And then, as I said, layering on that law enforcement piece of it, right? You can't have a police department that's an occupying force when you're trying to really change an entire community and a culture. So everywhere that we can create those linkage points and that access for individuals, whether it's to, again, addiction services or mental health services or job opportunities or educational opportunities, it is that collective impact of working at that level to ensure that those changes happen, and then pushing the limits. I mean, I would love to see an ability to do more creative things to create those truly mixed income neighborhoods. We have one neighborhood here where we're trying it. We have a redevelopment plan for an area called Park South, which is right next to Albany Medical Center. Albany Medical Center has been a great partner because they've invested a lot and developed a lot and grown the hospital and created jobs. So that's a project that started with low-income tax credits, and now we have 268 market rate apartments being built in a neighborhood that used to have the highest crime rate in the city. So what I don't want to see happen, though, is for that that workforce housing to be forced out of that neighborhood. Right. So we're going to have to be really purposeful in the investments that continue to occur to ensure that we're able to not just displace people, but to create a vibrant, truly mixed income neighborhood. That's the goal, and that's the vision. But finding the ability to do that, that's why I love the idea of what you guys did with your 9%.
Yeah. So with the 9% credits, I mean, Treasury regs require you to remain an affordable housing development for 25 years. So you've got that in place. But with those unique policies adopted, I think you can continue to do that. One of the coolest projects that I'm continuing to work on began to my day job. I'm a lawyer. I do public finance. Reading through bond resolutions and indenture agreements and tax credits, applications. But I moonlight as a policy person and just talk about these lofty ideas, and sometimes they land. But there's a developer that I'm developers counsel for, and he lives in New Orleans. He helped rebuild New Orleans after Katrina. Built Canal Street, the Riverside development. His name is Joe Canizero. Joe is in his 70s, has done really well as a banker and as a real estate developer in New Orleans, but owned a large piece of property outside of Biloxi, Mississippi, and wanted to do a retirement community. Katrina came in and leveled things and turned Mississippi around, good and bad. But after Katrina, Joe started coming up with different ideas, and I met with him the first time. I was a staffer for the governor of the state of Mississippi, and he talked about wanting to get Katrina money to help do certain things at Tradition. But it was at the same time that the governor was developing his healthcare as an economic driver vision, and so we turned this community into a healthcare zone. And on this community right at Tradition, it's a developing community, not yet incorporated as a city, but in 10 years we're expecting 20 to 25,000 people. You currently have a university that houses its business school and nursing school. It's overflowing with students. They're going to have to continue to add on. You have a community college that received $15 million in Katrina Community Development Block Grant funds to build a nursing school, which not only A, creates jobs, but B, there's an economic multiplier because you're putting more nurses out in the field, which are ultimately more jobs. And C, we've got the same William Carey University that exists at Tradition is in the early stages of planning to build the state's second pharmacy school. We only have one pharmacy school in the state of Mississippi. So to build the state's second pharmacy school. We're currently working on an initiative. We've created a nonprofit called the National Diabetes and Obesity Research Center. It's a nonprofit created to really research and thwart what is one of the largest killers in Mississippi, and that's diabetes and obesity. And we hope to announce in July our partnership with one of the top leading researchers in the world for diabetes and obesity. And we did that, again, with leveraging other assets and other resources. We were hit with the BP oil spill, and we were able to get some of those funds to help fund this think tank. So we're truly building a suburban medical city all around healthcare with student housing, retail, hotel, but the main anchor is healthcare. It's similar to a community in Florida called Lake Nona, which has over $5 billion of investment all around healthcare as well. So we're going to continue to work on that path, but it's a really cool project that I've seen from beginning, and hopefully we'll continue to have that client for years to come.
Trey, I was going to say, I think this new development that you're involved with, I think it has a tremendous opportunity not only to highlight health research and health care, but healthy community design, healthy building design. I mean, if everything can be built actually to address supports for active living, healthy eating, so that you can actually, from an upfront perspective, right, deal with the prevention of these conditions as well as their treatment. That would be a fantastic thing. We should talk after. I was going to say that I think one of the things that I keep hearing on this panel is the importance of housing policy. And I think housing policy is extremely important because it shapes so many aspects of the determinants of health. So of course, the physical determinants of health that we've talked about, the built environment, but there's also the social determinants of health, right? Social supports, whether you have a sense of community, whether you can actually meet your neighbors, how many people you have that you feel you're connected to. Those are actually really important elements, actually, also of health. Whether you have access to good education and you can get a good quality education is also really important, right? And so I think one of the key issues we need to be thinking about is, in terms of housing policy, for areas that are impoverished, that need improvements to the physical environment, that need investments, right? How do we think about bringing market rate housing in without displacement and with even potentially expansion of affordable housing? And this model of the mixed income housing, that is something that actually is the new model for affordable housing across the country, across other countries like Canada, as well as the US. And so this is not, I think that there are many cities across our globe now that are doing this. And if we don't do it, we're at risk of falling behind, I think. The other issue, of course, is when you don't do it, you then have concentrations of poverty, and you actually have concentrations of wealth that actually may not serve everyone either. So there are literally communities in New Jersey that I'm working with, right, that are seeing dropping school enrollments in very, very wealthy communities that have really good schools, right? And that's because the only things that they have there are low-density, single-family mansions, right? And the older people actually, some of them want to move, but they can't move because they love that community, but there's no apartments or denser housing for them to move into. And so as families age, there are no new children moving into the school system to actually repopulate that school. And so there are tremendous opportunities, I think, for also thinking about how housing policy, even in high-income communities, can do two things. One is help to keep really good schools open for the kids who are already in those schools, but also increasing opportunities for a diverse income population to enter those schools while helping those schools to stay alive. So I think that there are opportunities today and trends that we're seeing that, and also an aging population that we didn't really know about maybe before, right? We didn't have schools shuttering. We didn't have actually communities necessarily that had only big family, a lot of our older communities have downtowns and a higher density than how we've created new suburbs in the last few decades. And so we are now seeing some of the consequences of that. And they present both challenges to us, but they're also opportunities for us. I also just wanted to add, I think, in addition to the housing policy, you asked about approaches and strategies. And I think, Mayor, you spoke about the need for cross-sectoral collaboration. I've worked now with over 40 cities globally. And in these 40 cities globally that I've worked with, a big part of what we do is look for strategies and implementing strategies that would facilitate cross-sectoral collaboration, right? And so I think, Dorcey, you and I in the car were talking about some of these potential opportunities. They include, for example, holding conferences and conversations like this. But this can actually be expanded upon, right? To actually have a conference where we are actively addressing key specific issues that we need to address as a community. So perhaps it's a half-day or a one-day conference that concertedly addresses these things. So, multiple cities across the US have done this, and I've had the opportunity to help them. Cities in Canada and Australia, London in the UK, Brazil. There's also, what's also important, in addition to the conversation, is we all have organizations that we work for or lead, and we have staff, right? And so there are only so many of us who can go to a conference. But it's important to have trainings, actually, where people from different professions are actually brought together, and they're actually problem solving together. So last year, Columbia University asked me to design a course for them called Designing Healthy Cities that would actually target different professional groups to come together for a one-week intensive practice-based course. I'm in discussion with University in Florida to hold this later in the year, in November. But that's something that we could do here in Albany too, via Excelsior, if that's something that you guys are interested in. I think a third piece that's really important for both for traction and for movement is public engagement. And I think health gives us a real opportunity for public engagement because, even if someone's not particularly interested in issues of greening or in a particular neighborhood, we can talk about health as something that everyone cares about. If you're talking about the health of my kids, my family, my aging parents, those are things that actually bind people to look for collective solutions, right? So I've been in seminars. For example, when I first got to the city of New York, I was asked to go to various planning workshops, right, to get introduced to these ideas. And I was literally in some workshops where, the facilitators so health wasn't really on the table yet at that point with these planning workshops. And so people presented stuff like, hey, we're going to be redeveloping this neighborhood in Brooklyn, this particular block, and we want your ideas. So guess what sorts of ideas came back from people? They were like, don't take away my parking. Was a key thing that came up. People were talking only about the things that they were concerned were going to be taken away, right? And so the workshops that I run with my team now take a very different approach. We take a health approach. It's focused on how do we improve health in our communities for the families that live in our communities. And the conversation that ensues is actually very, very different with the public when they're thinking about their kids, their aging parents, themselves and their families, and what it would take in that community to improve the health of their families.
Thank you. So we'll hear from you, Kaitlyn, and then what I would like to do is open it up to the audience if you all have questions. So start formulating those questions in your mind, and we'll make sure that we get your questions.
Great. So I just wanted to talk about a few opportunities to find out the strategies and approaches that are happening across the country. So there's an online network called the Build Healthy Places Network. And that organization exclusively looks across the country to see what's out there in the links between health and community development, develops stories, disseminates strategies, and it's really about spreading those strategies across the country. And one example that I've learned recently about is an organization called IOBE. And IOBE is in our backyard. It's the opposite of NIMBY, right? And this organization is, again, an online platform that really catalyzes an effort for citizen-led philanthropy. So what happens is somebody in a community has an idea. Maybe there's a vacant lot, and they say, okay, I really want to make that into a community garden. So they can go online, go through the IOBE training process, learn how to campaign their work, because you can find out that maybe it'll cost $3,000 to revitalize that that site, that vacant lot. And $3,000, that's a lot of money, but it's actually difficult to get access to $3,000 to do one vacant lot in one community. And so you can provide this platform that then you can sort of use social media to crowdfund not just money, but community resources. So through this platform, you can collect volunteers. You can donate your expertise for engineering the plumbing to make sure that the community garden gets watered. And so what's really exciting about these opportunities is that people from all over the country are going on this platform and donating their expertise. Now, they're also developing out a relationship with government. So we need to make sure that when that lot goes up, you have the correct permits in place so that they'll walk you through how to work with the government to make sure everything's in place so that it's actually going to be there. And then in Memphis, the IOBE organization is located in a few key cities, but their work is national. But in Memphis, they actually partnered with the city, and there was a park revitalization project that the city was $60,000 short. It was not going to happen if they didn't raise $60,000. So they partnered with IOBE, and IOBE, through social media, through specific campaigning, raised the $60,000 from the community of Memphis, because the community of Memphis said this is something that we want. So it's really opening up a whole new area of budget allocations, of how we think about the community's involvement in government spending. And so it's just a really exciting opportunity, and I encourage everyone to take a look.
Thank you. Some great strategies. I saw folks taking notes. Brenda, I saw you taking notes. So now we would like to open it up to you all, and I see Harris, your hand is up. So we'll take your question, and Mike will be traveling with the microphone. Harris is in the back behind you.
So I work for a settlement house, and settlement houses are historic social work sites built to as place-based strategies to help neighborhoods, the ones that we're talking about, cope with change and new people and all the economic change that's involved with people leaving for the suburbs and so on and so forth, and new immigrants coming in. The problem that I see is in the federal government and state is that social policy and funding formulas are built around themes, whether it be criminal justice, even DSRIP and healthcare reform. It's all about one particular theme. Social welfare, child welfare, it's all separate. And so it all handcuffs our communities from looking at place-based strategies, neighborhood by neighborhood, block by block, because each one is different, to come up with a strategy that's organized, strategic, and responsive to the particular needs of the people that live there. And everything that was suggested about getting us together, our hearts beat to that, but our hands are tied behind our backs in a lot of cases because of this. So
Well-
I'd like to hear what ideas you have about that.
So one of the things that's happening in New York State, and we'll see what happens, is that we were on a list that nobody wants to be on, one of the 10 poorest cities in upstate New York. So the state is providing us with $1.5 million to do planning around anti-poverty work. And the approach is one where the work is being pushed forward not by community-based organizations that seek to provide services, but they're in the working groups, but that at the macro level, we're looking at what are the needs in the community to address poverty. And my hypothesis, because I share your observation, is that the challenges that we hear time and time again from our families, right? It's transportation, it's childcare, and then it is this rat's nest of social service, all well-intentioned benefits that are available or not available, depending on whether you earn 10 cents more an hour than you did, when you started, right? And so it's, those are the things that we have to get our arms around, because it is those policies that I think make it very difficult, and it's because we have all of these different funding streams. One of the most frustrating moments that I have had since I went into public service was, I knew of a couple that had a 10-week-old baby, and they were living in Washington Park, and it was 100-degree heat. We were in the midst of a heat wave, and this couple was living in our park with a 10-week-old baby. And I was with a group of very well-intentioned people, all social service providers and community-based organizations, and we were talking about collective impact and what we do to change outcomes, and I said, there's a baby right now in Washington Park. What is this group doing? What is this work doing in order to help that child? And someone slipped a note across to me and said, how old is the mother? Right? Because if the mother was between the ages of 18 and 24, there was a program for her, right? But if she was 25, they couldn't help her. And it's not because this person didn't want to help her, but it's because of exactly what you're talking about. And so I think that is the thing that we have the opportunity to address. We have to be brave enough to have that conversation, and we have to push that forward, because it's not going to change if we don't do that work and demand that we start to look at this from a holistic standpoint, so that a mom doesn't say, nope, I'm not going to pursue this great job opportunity, because if I do, I no longer qualify to have childcare.
Thank you. So we have, Dr. Lee, you want to chime in, but we do have some additional hands up. So we'll go, Dr. Lee, you can chime in, but afterwards we would have this gentleman here, and then Commissioner Jonathan Jones over here.
I'll try and be quick. I just wanted to say, I think our funding pot's siloed, absolutely. Should we be advocating for breakdowns of the silos? Absolutely. But I think at the community level, and when we're actually dealing with things in our cities themselves and in our neighborhoods, it makes the cross-sector and cross-disciplinary collaboration even more vital, because if we have good relationships and good initiatives across different sectors, we can actually tap into these different pots to help us fund the things that we need to do collectively in these neighborhoods. So it makes it even more vital, I would say.
Thank you.
Thanks, Mike. Hi, I'm David Liebschutz. I have a consulting practice, but I also teach at SUNY in Siena. My question is not with the 10-month-old, but at the other end of the life spectrum. And several of you have talked about retiring in place. Albany has a naturally occurring retirement community in the Hackett-Whitehall neighborhood. We see that as the aging of America, and I still have an aging mother and all that kind of stuff. Talk a little bit about thinking about how we effectively age in place and provide supports to our seniors who want to stay in their houses but might not have the resources to do so. How would you see that working, and what work have you all done to make that a reality?
I would say that a key part of thinking about aging in place and healthy aging is how we design our communities, right? So, for example, if we have communities where you have to drive, then you can't age in place there. Two things will happen. One is you're driving way longer than you should be, and that impacts the safety of yourself and everyone around you. And who can blame people for doing that, right? Because you don't want to become dependent. Number two, you have to leave as soon as you stop driving, right? And so that's not allowing to age in place. That's breaking social networks and social bonds. And even if you have services, and services, of course, and support services are part of it, but even if you have them, they will very quickly, with our aging populations, become overwhelmed if we don't also think about how we're improving our communities. And so when we're designing new communities, if we're expanding in certain areas, that's a tremendous opportunity to think about designing those communities healthily, including for aging in place, because they're synonymous. Number two, when we're renovating communities, that's also a great opportunity to think about how we could be doing it differently. It's not necessarily just upgrading the existing infrastructure, but can you actually be thinking about increasing density, bringing in, including using zoning policy where needed, bringing in additional uses that would allow people to have amenities close to their homes as they age. So those are some of my thoughts.
Thank you. Trey?
Sure. Through some of our planning policies, the way we drafted things, we encouraged, through the QAP, the more points you got in terms of your development was based on where you located. And certain developers in certain areas that weren't as dense, you would have to create a plan for that community. So that's the way we drafted it. We said, if you want these points, then you're going to have to fund this plan. So you had a willing and ready mayor saying, great, I've got this plan in place, and we put certain criteria that said the development and the investment, we're going to push it within this 5-mile radius around the hospital. So the idea behind that was clustering all within a centralized location. And so the development was supposed to happen organically from the standpoint within the 5-mile radius.
So just very quickly, and again, this is now Albany-centric, right, in the neighborhood that you're talking about. So first of all, we need Uber and Lyft. We need ride sharing. I hear that from our seniors all the time. They don't want to have to worry about cash. First of all, we have a terrible taxi system for those of you who aren't from here. There was somebody who I heard on the radio say, well, what about dispatchers? Dispatchers are going to lose their jobs. And I thought, well, if the dispatchers were polite, maybe I would care. But, there'll probably still be openings at DMV. But we need to get into the 21st century, right, and provide those amenities. But what we've lost is that kid next door who would come and shovel the driveway, right? So, these are not, it's just not the way that communities, they worked for a really long time. It doesn't work that way anymore. So how do we create that, right? And it's because we've created sort of, right, these concentrations of poverty. So that kid who would love to earn $10 shoveling Mrs. Smith's sidewalk, he's in Arbor Hill. He's in the South End. How does he find her, right? So that's some of the work that I think that we need to be doing as we look at particularly our community in our city of connecting people to jobs and connecting opportunity where it exists, because there is significant opportunity. What I hear from seniors is, I'd pay someone if they were available. I would pay somebody to come shovel out the bottom of my driveway. They can't even find that. So I think there it's an opportunity, and I really see focusing on that neighborhood and that community and the linkages and job creation opportunities that are there, but that need some sort of support underneath them to really make the linkages happen, is a great sort of still piece of low-hanging fruit that is yet untapped.
Thank you.
This is a question for Mr. Hairston. Hairston, can you tell us about, after the environmental tragedies and the ostracization that happened in Mississippi, how you were able to get the residents to get involved and to get trained and to better acclimate themselves to the resources that were available?
It's still a challenge. You know, two major disasters with Katrina in 2005 and BP in 2010. So, outreach. After Katrina, there was a major charrette done. Then Governor Haley Barbour put together a major charrette on the coast where we brought together stakeholders, we brought together national think tank, and we really talked about how to revitalize and bring back the coast. With respect to Katrina, there was almost $7 billion worth of Katrina CDBG that came through the state. A lot of it was rampant with fraud, and that you have to deal with. But in terms of getting the resources to the right people, or helping bring back a certain company that was the major employer. Ingalls is one of the largest employers in the state of Mississippi, but it's located in Pascagoula, and they build some of our nation's finest warships. And but we had to get the word out, and we had to make sure that individuals were connected to the right resources. So there were groups like Project Recovery, which was an outreach organization that provided mental health to those affected by Hurricane Katrina. There was additional resources with respect to healthcare to get hospitals back online, whether that were through the impact of makeshift hospitals or makeshift clinics, and expediting resources towards some of the main necessities of the day, food, water, health. And so that was the main thing that was done. With respect to BP, some of the same things, it was more of an economic hit than health. From the health standpoint, we're trying to make sure we bring back a healthy ecosystem from our fish and water animals, our shrimp or oysters. And so there are resources that are being pushed towards that in that respect. And from the economic standpoint, it's just really thinking through some of the best practices. If it's the National Diabetes and Obesity Research Center, then thinking through how do we use those funds for their best benefit.
Thank you. So on that note, Mike, do we have time for one more question? Okay. Any other questions in the audience? Yes.
Thank you. This may have been how you were going to conclude your remarks, I'm not sure. It's really a question, I think, for the moderator and the mayor. You've got a great panel here with very diverse points of view, and I think we've all learned something today. You've also got a room full of people who I think are very interested and passionate and want to bring something to the conversation. So my question is really, what next? Where do we go from here? How do we coordinate the various efforts that are going on in this region?
Thank you for your question. Mayor, would you like to? And I'll follow up.
Right. So, this is an area where we're still figuring out how to get out of the silos, right? So, the city does not have a Department of Health. We're not like New York City. So health is done at the county level, and social services are delivered at the county level. And so one of the things that we're finding through this process is that we've got to collaborate across those silos, because the impacts are hitting the city, yet our ability to influence what's happening is really happening at the county level and then at the state level. And so I think that the planning dollars that we're receiving from the state this year to really focus on how we really address issues that they're health issues, and I know that health issues cross all socioeconomic boundaries, but where we're really focused is on those impacts in neighborhoods where we have high levels of poverty and real critical challenges around access. And so I think that has to be something that comes out of that work, which is why I'm interested in the approach that was used in Rochester, where you had participants that were from the healthcare institutions, that were from the business community, from the state, local, and county level, really looking one another in the eye and saying, why aren't we have all these programs, why do we still have these outcomes? And so I think that we've got to really, it is time to step away from it, really take a very different view, take advantage of national and international experience and what is working and what has happened. When you have a situation like what happened with Katrina, where you have a crisis that forces you to rethink everything, what can we learn from that? Why we don't want to have to wait for a crisis to really address these issues. So how do we learn from what has happened in order to be able to have better outcomes in our city and in our broader region?
And I'll say from the standpoint of working with the college, we have various team members from the college, including our two deans from the School of Health Sciences, Debbie Sobchak and Laura Nagelsmith. But we have already started asking the question, what's next? And so that could be, as Dr. Lee pointed out, it could be hosting possibly a conference where we continue this dialogue with some very key next steps that could be tied to that conference. And so as a college, we've already started having that conversation, so I would just say be on the lookout for additional information coming from Excelsior, because we plan to continue to strengthen our relationships and ties with the community, and we want to continue dialogue such as this.
And can I just add, community is key. We've got to meet the community where the community is. And so we are not going to be able to answer these questions with the people in this room. Nothing against any of you, nothing against any of us up here. We need to understand what are the barriers, what are the challenges, and what are the needs of the community. And that's where we have to start. And so that component of it is going to be critical to really having success in the work that we're seeking to do. I'm encouraged by what the community is looking for and that have expressed what the needs are. And I think many of us would be surprised by what some of the priorities are that the community has been communicating, as opposed to what somebody at a CEO or policy level might have been thinking. So that piece of it and any ability that you have to facilitate that conversation is critically important.
I would actually ask if members of the audience, I know you guys have been great at asking questions, but if you have thoughts to share, I think, with the group about what you see as potential next steps, I think it'd be great to hear, actually, based on what you heard here, and your own experience and ideas of the local context is really important as well.
Any takers?
Yes. Takers?
Well, as I listen to you, and this is a subject that personally is near and dear to my heart. I am also from Excelsior College, and I'm not in health sciences. But I see two things, one for the city of Albany, or one for some of our areas where we really want to address a more healthy environment. And I was thinking about a couple of things. One is, I know that the libraries in some cases have vans that go out into areas to provide access to books. I also know that we at the college have CEFCU come, our bank, comes on site. What about partnering with one of the grocery chains to bring a van or truck into areas like my grandfather did when he was a fruit and vegetable peddler as a new immigrant here, to bring healthy foods to communities? The other thing I thought about is my own area, and I live in a suburb in Guilderland. And I've often thought that our neighborhood could be a poster child for being active physically, because so many people walk, run, bike, et cetera. But yet I was thinking about the lack of a sense of community as I myself enter those years where there may be challenges about lack of transportation, access to community services and things like that. And one thing I thought I could do is, on my block, get people together, or my block and the next block, to say, we are a community, let's get to know each other. Let's think about how we can partner so that your son can shovel my driveway when my husband can't do it anymore. That kind of thing. I think on a very personal level, there are some things we can do.
And thank you. For the sake of time, and being mindful of your time, I would encourage you, if you have ideas, I will be here. So if you want to just mention some of your ideas to me, I would love to take them. I want to say thank you all for being here, and also want to thank our panelists for being here. So let's give them an applause as Michael comes up.